Ebola is on everyone's mind right now, and including here in New York this week. You just came from a session where a lot of key stakeholders were discussing what to do next. What is your takeaway from this week here from New York? Are we making progress? And what is coming next?
One really important learning is that the conventional health models are not necessarily the ones, in fact probably should not be the ones that we pursue, where it's a traditional hospital, a traditional doctor, a nurse. We need to think of other formulations that work even better in these countries. We're seeing with the Ebola crisis that community health workers, for example, are really playing a vitally important role with very little knowledge. They may have a little bit of experience in dealing with malaria or other diseases, but now they're having the added burden and responsibility of caring for people with this very severe disease, Ebola. So I think thinking about different constellations of actors and different roles that people can play in health systems beyond what we think of as the traditional, almost Western model of medicine.
And there's a lot of new pledges and announcements and commitments here at CGI this week. And of course, throughout the year, we have wonderful new initiatives being rolled out, including from the Rockefeller Foundation. Now, what innovative new idea in global health are you most excited about right now?
One that is very exciting is that we're working together with the World Bank now to develop networks of practitioners in different countries seeking to achieve universal health coverage, to build up their health systems. And it's peer-to-peer learning between those countries of mid-level officials who are on the ground, developing the systems, delivering health care every day. They know what the challenges are. They see it every day. So we've been able to bring them together in a joint learning experiment that seems to be working. It's called the Joint Learning Network. So that's our latest innovation, is creating networks so that countries that are at kind of similar places in their development of their health systems can share knowledge, encourage each other, and advance together in this cause. There are now 9 countries in that network. By sometime next year, we expect it'll be 20 or more. It will continue to grow and really make a difference in the progress of these countries in advancing their health systems. The countries themselves, it's kind of interesting, the kinds of issues they want to tackle. It's not only how to finance their health systems, what system of taxes the country needs to develop, but it's looking at things such as the role of the private sector. And in many cases, countries are not even aware of so much that the private sector is doing in health. And so this network is able to help survey what is going on and then integrate the activities of private sector with what governments are doing in the health world. Very exciting. Very exciting.
It seems like we're taking 2 words back home here from this week in New York. It's partnerships and it's systems, right?
That's right. Systems sounds as if it's kind of an impersonal thing, but when it comes right down to it, it's about caring for every individual across the planet. And that's why we have as a focus at the Rockefeller Foundation on promoting universal health coverage so that everyone in the world has the benefit of affordable health care for the comfort and health of their families, but also for the security and resilience of their economic resilience, health resilience of their families and their communities.
And I know that our readers and our watchers are going to be looking to the Rockefeller Foundation for a lot of guidance on some of these issues. So thank you so much for sharing these thoughts with us.
It's a pleasure.